Good morning. My name is Annika Jones, Business Analyst with the Department of Community Health, Health Information Technology Division, Health Information Technology Unit. And I'm also today's webinar administrator. I would like to welcome you to today's webinar, Balancing Privacy and Data Access During a Crisis. But before we get started, I would like to review a few housekeeping tips. This presentation is being recorded. If you have any questions, please submit them via the chat or the raise the hand feature. I will unmute the phone lines at the end of the presentation. You may have to press *6 on your phone in order to unmute your line. The Department of Community Health's mission is to provide access to affordable quality health care to Georgians through effective planning, purchasing, and oversight. And we're able to, and through interoperability, it plays a major role in the secure use and exchange of health information across the state of Georgia and beyond, especially through its partnership with the GAHIN. This partnership works closely to ensure that providers and caregivers can access patient health information at the point of care to optimize outcomes and reduce costs. So DCH is definitely on point when it comes to partnering for success. We're able to do this through the clinical viewer, which gives Georgia Medicaid providers access to this information via the Georgia Medicaid Management Information System, otherwise known as GAMMIS. And we have developed training on the simple steps needed to sign up to access the GAHIN, as well as how to navigate within the electronic record. By accepting the terms and conditions required prior to access, and by primary functions and navigations within the GAMMIS clinical viewer, you'll be successful with using this tool. Please see the link that's displayed on your screen for more information. However, you must have an active, authorized GAMMIS login and accept the terms and conditions one time prior to gaining access to GAHIN data. Today's presenters are Lynn Hood, Marketing Manager for the GAHIN, and Michele Madison, Partner at Morris, Manning & Martin. Lynn will provide the GAHIN overview, and Michele will present on balancing privacy and data access during a crisis. Welcome, Lynn.
Thank you so much, Annika. I appreciate it. Let's go to the next slide, and I'll tell you a little bit about GAHIN. GAHIN is Georgia's state-designated health information exchange, or HIE. We work to create a healthier Georgia by advancing patient-centered health care, increasing efficiency, and improving the health of the state's entire population through the use and exchange of electronic health information. Next slide. We create a statewide electronic network that pulls together information from hospitals, physicians, behavioral health, even school clinics and long-term care. We've even got GAHIN being used in EMS and ambulances. Next slide. We have two primary products. The first is Georgia Direct, which is a simple, secure patient information exchange, and then Georgia Connected Care, which is query-based. Next slide. So for Georgia Direct, this is a free email messaging service. It is HIPAA compliant, and it is used to send information to authorized healthcare professionals. Last year, we sent and received more than 1 million transactions through this. Next slide. Our query-based product is called Connected Care. We've got approximately almost 15,000 connected providers through many of the large hospitals in the state and through the rural regional health information exchanges. We had almost 4 million queries last year, and we have 36 million individual patient records within the system, indexed within the system. Next slide. We have a large number of connected organizations, including 5 hospitals and health systems, 5 state agencies, 4 regional HIEs, and the 4 care management organizations, plus in the National Exchange, Veterans Health, the VA, and the Department of Defense. We're also connected to 4 surrounding states, Alabama, East Tennessee, South Carolina, and North Carolina through their HIEs. Next slide. So we have a wealth of information available through GaHIN to providers across the state and actually throughout the nation. So, but during this time, we had thought about doing something on privacy and security, and then the pandemic has changed things so much, we wanted to switch that around a little bit. Next slide. We're absolutely thrilled to have Michele Madison with us today. She's a partner at Morris, Manning & Martin. She's very experienced in legal issues around hospitals, physician offices, and health systems. She speaks frequently, locally and nationally, and she's a member of the firm's COVID-19 task force. Michele, I'm going to turn it over to you. Thank you for being with us today.
Thank you, Lynn. Good morning, everyone. So today we're going to focus on the HIPAA privacy and security rules. We can go to the next slide. As we focus on these rules this morning, I'm going to talk about, and we can go to the next slide as well. I'm going to focus on what our requirements are as healthcare providers, because although we're in the middle of this pandemic, we still have to comply with the HIPAA rules. There have been some waivers, limited waivers related to HIPAA on the privacy side, and there's a limited waiver related to technology on the telehealth side. So I'm going to start today talking about some of the disclosures that have been hitting all of us during the crisis and what we're allowed to do and what we're not allowed to do. And then I'm going to talk about the waivers that do apply on the privacy side. And then I'm going to talk about the telehealth waiver. So that's a lot of information to get through in a short period of time. So some of the slides in here will be for your reference, and I've included them so you know what code sections to refer to if you need to in your own positions as covered entities. So first and foremost, from the privacy rule standpoint, we still, as covered entities, have an obligation to implement those reasonable safeguards to protect the information. We also have to continue to comply with the security rule. These rules have not gone away, they've not been waived, and their penalties still exist today. So let's go to the next slide. Our general rule related to disclosures is the same as it always has been, and that is we can use patient information for treatment, payment, and healthcare operations. That's what TPO is, treatment, payment, and healthcare operations, without having to get a specific authorization or consent from the patient. And then there are other circumstances where you're permitted to use a patient's information or disclose it, but it depends upon the actual situation. And those restrictions that we've all been used to for so long don't go away at this point in time. The areas that I am seeing the most amount of questions come across my desk are the press releases. So obviously we have patients that are being tested for COVID-19 and they're testing positive, and the hospital wants to get out to say, okay, yes, we had a patient, they came in on this day, and this is the situation. They're either in the hospital or they've been discharged home under isolation orders and treatment orders. We have to make sure that we're not disclosing the patient's identifiable information in those press releases. And I've seen them all across the board. I've seen some that talk about the age and the gender of the patient. I've seen some that don't say anything about the patient except for the day that they were in the emergency department. And really from that standpoint, it's so that other individuals in the public who may have been in the emergency department on that day know that they were exposed, so they can take their own precautions of either being quarantined or isolating themselves as needed. So making sure the press releases do not identify a patient. And then for our employees, this is a critical time for our privacy officers and security officers to remind our staff that we cannot disclose patient information and identifiable information in the community. Everyone is talking about this pandemic and who has it and what's happening and is its community spread. And this is a great opportunity to remind our employees that we are healthcare providers and we cannot disclose the identity of those patients. And then also, this is a good time when you're doing auditing and monitoring of your records to look and see if there are employees who are going into the patients who we know have been identified as COVID-19 patients, and if they're looking at those charts when they have no reason to be there. It's another educational opportunity. And then, as you all know, the governor also issued a statement notifying everyone that even if you get a press inquiry, you cannot release the name and identifiable information about a patient to the press. Let's go to the next slide, which has guidance about the disclosures related to the media. It is critical that we do not release the information about a patient unless the patient consents with an authorization that's signed in writing and conforms to the HIPAA authorization requirements. My advice has been just don't identify the patient at all, because we can get information out to the press that we have a COVID-19 confirmed case without having to identify the actual patient and putting their safety in jeopardy. Under the HIPAA rules, if someone queries the hospital and requests by name whether a patient is there, if the patient has not objected to being in the directory, you can release the same kind of information you would under normal circumstances, which is either yes, they're here, or no, they're not here. Very limited information, and that's if they did not opt out of being in the directory. If they opted out, you can't even confirm if that patient is there or not there at the time. So again, with the media, avoid any identifiers about patients. Stick with your normal HIPAA privacy rules and regulations and the policies that you have in your organization. Let's go to the next slide. Under HIPAA, we are permitted from a healthcare perspective to use the information for treatment. And even as late as today, the OCR provided some guidance that we can release information to first responders for purposes of treatment as well. And then for public health purposes, and as healthcare providers in our state, we would report the positive COVID cases to the Department of Public Health. And in those instances, you are permitted to release identifiable information to the Department of Public Health, but it needs to be the minimum necessary information that you need to disclose to them for purposes of that public health disclosure. And it can only be disclosed to a public health agency. So we can go to the next slide. As a public health authority, that's an agency of the United States. So when we talk about the Department of Public Health, that's an agency of our state. And under state law, and I included the section here, we do disclose very specific facts to CDC and the Department of Public Health, but again, limited facts to what they need to know to be able to carry out their public health functions. If they are cooperating with a foreign agency, they can release information to that foreign agency. I have been advising my hospitals to let the public health department determine who is involved in that agency's review and investigation of these cases. You disclose as a healthcare provider to the Department of Public Health. They coordinate with the CDC and any other foreign agencies that they may be coordinating with. Let's go to the next slide. In addition to the disclosures to the Department of Public Health, under public health and safety, under the HIPAA regs, and I've included the regulations section here for your reference, if there is someone that's at risk of contracting or spreading the disease, so if we're in this instance, let's say that my babysitter has contracted COVID-19 and she has been watching my children for the last week, the healthcare providers may say, well, we might need to notify these individuals, me, that my babysitter has COVID-19. And what they should do is contact the babysitter to confirm that she does not object to releasing that information about her status. Or if she's incapacitated, they have to make a judgment in their independent medical judgment of what is appropriate to protect the public and anyone who may be at risk of contracting or spreading the disease. So the Department of Public Health is authorized to make those disclosures as well. Typically where I see this arise is related to someone is diagnosed with COVID-19 and we know that they were at an event and there were 25 people at that event. Then the public health may reach out to inform those individuals after the hospital has informed the Department of Public Health. That's how I've seen this work so far over the last several weeks. Let's go to the next slide. There are family members who have been involved in care and they may have been exposed. So a covered entity can share information with a patient's family. And by doing so, they need to determine whether or not that individual may be exposed. Same under that public health part where the Department of Public Health can tell individuals who may be at risk of the spread or contracting it. If someone's going to care for another individual, that healthcare provider may determine in their independent medical judgment that they need to notify the friends and family and those individuals that were involved in their care so that they know what precautions to take to protect themselves from the potential spread of the disease. And so when we're engaged in that kind of activity, normally the covered entity would First of all, determine whether or not the patient can identify who would be appropriate from friends and family and others and individuals to identify, to share that information so that it's not a broadcasting of information in the public forum, but it's more a one-on-one correspondence to individuals that were identified by the patient. And if the patient is incapacitated, then the healthcare provider will make the decision about who's the appropriate individual who should get the information about this individual's diagnosis. So, for example, a provider can determine for an elderly patient that they need to share information with that patient's adult child or someone who's going to be involved in caring with them that, yes, your mom or dad has COVID-19, and so these are the precautions you need to take as they go home, or they have COVID-19, they're going to be in the hospital, you were exposed to them during this period of time, these are the precautions you need to take. So that's if they're incapacitated. Otherwise, we would normally ask the patient to consent to that type of disclosure. And if they don't consent, the Department of Public Health, under their agency and their guidance, may determine whether or not a disclosure is necessary to prevent the spread of the disease. Let's go to the next slide. Providers, individual providers, can make decisions, and I've talked about this a couple of times, based upon their independent medical judgment of whether or not they should share patient information with anyone other than those individuals who are already involved in the care. So the way HIPAA separates this is there are disclosures to family and friends and others involved in the care, and when that happens, you try to work with the patient to get their consent, figure out who needs to be notified. If they're incapacitated, the physician makes the judgment of who needs to be notified. Then there are disclosures under HIPAA to individuals who are not family and friends and those involved in the care. And in those instances, the individual provider has to make a decision about who to share patient information with to prevent or lessen a serious imminent threat to the health and safety of the public. And that really comes down to the provider's medical judgment of has there been a large exposure and whether or not the nature of the exposure puts the public in general at risk. And so having to disclose information, and whenever there's a disclosure of that type of situation where we're talking about general public or people who are not family and friends, we need to make sure we're only disclosing the minimum necessary information. So maybe we disclose the date that this patient came to the hospital on this date, we had a COVID-19 positive diagnosis or test, and we know that they were in these public places during these dates without identifying the actual individual. Always go to the side of using the minimum necessary information so that we protect the patient's privacy and confidentiality to the greatest extent. Let's go to the next slide. Again, I just hit on the minimum necessary side. This is critical because if we can avoid disclosing the patient's identifiable information, that protects the patient's privacy and security while allowing public health and the threat of potential spread of the disease to be addressed by just releasing a date or a location without identifying the individual. So again, minimum necessary information in all instances, and this is something we really need to educate our staff on to avoid that inappropriate disclosure to the public. Let's go to the next slide. So under the HIPAA privacy rules, there are situations where the government has given us a limited privacy waiver, and I mean limited. So if you're a hospital and you've implemented your disaster protocol, then during the 72 hours that that disaster protocol has been implemented, if you are in a situation where you're unable to go consult with the patient, so you feel like you need to tell friends and family of the patient that they've been diagnosed with COVID-19, the first step is you're supposed to ask the patient for their consent to release that information. And when you're in a disaster protocol and all your resources are focused on this disaster and your emergency mode of operations, you may wind up disclosing information to a family member without actually asking the patient. And that will not be subject to fines and penalties if you're within the 72 hours of your disaster protocol occurring. My guidance to you would be try to always make sure you ask the patient. Our goal is always to protect the patient information and only disclose the minimum necessary information we're required to do. But if this happens during the 72 hours after a disclosure protocol, there is a waiver right now. And then to opt out of the facility directory. So normally when we register, when we go to a hospital, it says, do you opt in or opt out of the facility directory? And if we forget to ask that question or we don't ask that question, during the 72 hours after our disaster protocol has been implemented, then we have a situation where we may not be penalized because of this limited waiver. The same thing during that registration period, we normally give the notice of privacy practices to our patients. Those should be on our website. They should also be in the offices or in our hospitals on the wall. But notwithstanding, if we fail to do that, there is a limited waiver for that. And then if we forget to say to a patient, do you want to restrict access to this, or you want to restrict your information from being disclosed during these 72 hours, we should not be fined or penalized under that disaster protocol waiver. And then finally, we can request from patients, do you want us to disclose information to certain individuals or to keep things confidential? So we allow them to have confidential communications. And if we forget to do that under the privacy rule, that is also not subject to penalty during that 72 hours. So that's the limited privacy waiver that we've been granted at this time. Let's go to the next slide. From a security standpoint, as many of you at home are working and all of us are working from home, we're getting to be pros at teleworking. It is important to try to make sure before our employees walk out the door that we've taken certain security precautions. Our security safeguards do not go away. We are not waived from complying with security safeguards under HIPAA. So try to use a secure portal where people come into a portal, do their information, but can't download information. Try to restrict that. Reiterate training on HIPAA privacy and security before we deploy people on teleworking. And if it was an urgent, you need to go home and work from there, and here's your username and password, send out a training module on HIPAA to your staff to complete while they're teleworking to remind them of their confidentiality restrictions as members of the workforce of a healthcare provider. If possible, I recommended having that confidentiality statement that we have a lot of our employees sign annually, sign before they go out for teleworking. Workstation use, you should have a policy on workstation use and your physical safeguards. Send that out to all your staff. And then encryption, if you can make sure that your laptops are encrypted and that you remind people to use secure entry or VPNs while you're working remotely. And then constantly send out little reminders, not every day because we're all overwhelmed, but little reminders as we go through this process. Please make sure you don't allow individuals to use your workstation that aren't authorized. Please don't download PHI, don't email PHI unless it's encrypted. Those are the types of things we need to continuously remind our staff. Let's go to the next slide. The next couple of slides I'm going to talk about just briefly. I included the administrative, physical, and technical safeguards for you to review because these don't go away. I can't reiterate that enough. We do have to maintain these policies during this pandemic and during this crisis. Our emergency operations plan should be in effect at this point, and we should have a security officer who is overseeing who has teleworking authority, who has user IDs. Let's track and make sure that we're not having excess entries or individuals going into records that they shouldn't be in. And then now more than ever, the contingency plans and making sure we have backups on our servers, because I know for a lot of us, some of the systems crashed when everybody went home to work from home. So making sure that we've got backup systems to maintain our data. So the next couple of slides are just reminder checkboxes for you to make sure you've got these policies and procedures, and then to remind you that we do need to consistently do education on HIPAA with our staff. And so sending out just little tidbits of remember, log out, remember, don't walk away from your computer for more than so many minutes, remember, don't share your password, remember, don't email unless it's encrypted PHI. Let's go to the next slide. This next slide has the physical safeguards, and I took out one of them because it's facility access, and most of us are not accessing our facilities right now. We're all remote. So reminding everybody about workstation use and best practices, workstation security. Don't click on an email that you don't know the person. And now more than ever, the email phishing scams, which get us all the time, it's the biggest security risk we've got, I think. We need to make sure that people understand, do not click on a link and give up your credentials or your passwords to anyone, even if it looks like your IT department. Contact your IT department to ask, did they send that email? Our system has an email phishing thing. So every time I get an email that looks a little odd or they ask for credentials, I can click on a button that automatically sends an email to my IT department to tell me whether or not that's a phishing email or did they send it. So far, all of them have been phishing emails. So making sure we've got some workstation security mechanisms in place. And then device and media controls, reminding everybody not to download patient information onto thumb drives or hard drives to work from home. Keep it through a secure portal. Don't take the information out, and do not leave laptops in your cars as you are trying to go back and forth, or if you're going to the grocery store. Next slide. On this slide, I just included the security safeguards just to remind everybody. Access control is critical. Please do not let people access the system all using the same passwords. Everybody should have their own unique ID and password so you can identify who they are and when they're coming in. And then making sure we're using encryption as much as possible. Encryption is not required by HIPAA, but when you look at the fines and penalties in OCR's guidance, they do want you to do the risk versus benefit, and usually that is a benefit when they look at it from a standpoint of it's too risky not to have encryption on these laptops when we're working from home, or if we can use an encrypted secure portal, that's recommended. Let's go to the next slide. Now I'm going to get into the fun stuff about the telemedicine waiver that we just received from OCR this past week. Telemedicine is shooting off the charts. So we have a waiver that allows us to utilize devices like a smartphone to do FaceTime and video chat and Skype with our patients so that we can see them in their homes or wherever they are, because they can't really come into the physician practices for various reasons, one of which is just to avoid the potential exposure, or to the hospital physician practices. So if it's non-public facing, you can utilize this type of technology during this national and public emergency. It cannot be public facing. So FaceTime Live, for those of you that have teenagers, TikTok, and then some kind of software system called Twitch are not permissible. So FaceTime Live, TikTok, and Twitch are not permissible. Non-public facing, so just direct FaceTime with your patients. Let's go to the next slide. Under the telemedicine waiver, the OCR provided guidance on their website, which is very helpful. And it also says that covered entities can still focus on keeping additional privacy security mechanisms in place. Just because we have this telemedicine waiver that says you can use FaceTime and video chat and those types of things that are not public facing, you can also continue to use software systems that are secure and are HIPAA compliant. And they, being OCR, Office of Civil Rights, will not be enforcing the requirement for business associate agreements with these vendors during this national emergency. So if you don't have a business associate agreement, there have been a couple of cases where people have been fined for not having those. During this national emergency, for the purposes of telehealth, they're not going to fine and penalize us for not having a business associate agreement. Please remember, when this national emergency ends, then we will have to go back to the technology and the security of a secure HIPAA compliant mechanism of doing telemedicine, and we must have a business associate agreement. And OCR did provide some examples of the types of companies that have said they have business associate agreements and are HIPAA compliant, and that's located on their website. Let's go to the next slide. So that's just our disclaimer that this is for education purposes. And we went through a lot of information today, but I want to recommend that you look at OCR's website related to telehealth waiver. This is sweeping our state, and a lot of providers are really tackling it and using it because it's keeping their relationships with their patients, and that at all times protect the privacy and security of our patient information. We do not have a global waiver of HIPAA. It is still enforceable, and we need to make sure we only disclose the minimum necessary, and please avoid disclosing patient identifiable information to anyone unless it is for treatment, payment, or healthcare operations, or it's through the Department of Public Health and the CDC, or a patient has signed an authorization releasing you to release that information. Otherwise, you should consult the HIPAA guidance and make sure that the healthcare provider is aware of the restrictions that still apply under HIPAA. And Lynn, I'm going to turn it back over to you.
Thank you, Michelle. I was on mute in case of dogs. That was absolutely fascinating. So very interesting. And thank you so much for sharing your
Hey, Lynn, I think we missed you a little bit. Are you still there?
I am, and I'm very sorry.
Okay. It's okay.
Interesting this was.
Okay, I think we may have a little bit of technical difficulties there. So I would love to thank Lynn. Lynn, are you there?
I am, and I'm very sorry. Love that telecommuting. I was thanking Michele for sharing her expertise with us, and so it was just absolutely fascinating to hear it. And I'm sure very helpful for our audience. And I was asking if we had questions.
Yes, I'm going to go ahead and unmute the lines in case anyone has any questions here. Just one moment. Okay, the line should be unmuted. If anyone has any questions, we're going to take a pause here. If you have any, please feel free to ask your question.
And just a reminder to our attendees, if there's someone you want to share this information with, it will be available. You can download the PDF, the handout, and have capture that information. We'll soon have it up on the website.
Okay, thank you so much for that information. I'm just going to give a few more seconds, and if no questions, we will move on. Let's see, we have one question here, just one moment. Yes, the question on the table is, will the recording be available as well? And to answer that question, yes. Once we have the presentation downloaded, we will go ahead and send it out on the DCH website, and it would also be available on the GaHIN website as well. Thank you for your question. Okay, we're going to go ahead and move on. We hope that you enjoyed today's webinar and that it was very helpful and informative to you. Please stay tuned for future GaHIN webinars, and we totally appreciate your feedback during this time as well. So please participate in a brief survey following this webinar. And on the behalf of DCH and GaHIN, we thank you for participating in today's webinar. We hope that you have a wonderful day. Please stay safe, and we will see each other on the phone line soon. Take care.